We know that teams periodically encounter patients or family members whose communication style or behavior is challenging and disrupts the team's ability to provide safe and high-quality care. These encounters also negatively impact team members' resilience and well-being.
Stanford Medicine is taking tangible steps to develop a holistic approach to prevent, mitigate, and appropriately respond to the mistreatment of healthcare professionals by patients, families, and visitors. And while we always intend to provide the most compassionate care for our patients, there are times when such interventions are necessary. So today, we'd like to provide information on the new Stanford Healthcare DART team. DART stands for Distress Activation Response Team, and the enhancements to the Stanford Children's Health SAFTeam. In the hospital setting, mistreatment can take several different forms. It can range from subtle, passive-aggressive sabotage of care plans to more aggressive verbal threats or sometimes even physical threats. Unfortunately, we've seen the entire spectrum, but fortunately, we now have a plan to intervene at any stage of this spectrum. When we see situations in which a patient or family member in the hospital is displaying escalating levels of tension or verbal or physical violence, the intervention and what we've found to be most helpful depends on the severity of what is being presented. If anyone is looking to be in imminent danger, calling security immediately is the first step.
The DART and SAFE teams were developed to assist with de-escalation and boundary setting when patient or family member behavior is negatively impacting the provider and their ability to provide care. The Strengthening Alliances with Families team, or SAFE team, was launched at Packard in 2017. Because of the nature of pediatrics, the primary goal of SAFTeam is to be a bridge toward improved communication. And SAFTeam clinicians often succeed in repairing the relationship between the parents and the team. But there are situations where behavior becomes so disruptive to care that setting clear boundaries and limits becomes important. SAFTeam will guide this process and buffer the team from having to navigate those hard conversations on their own.
DART originally began over a year and a half ago as a part of the general medicine service line. We folded in security and various members of the service line, including case management, nursing, MDs, rehabilitation therapists, social work, and others. It was truly a collaborative effort. What we decided is that we needed to address all aspects of violence as they present on the spectrum, no matter how mild or severe. The workflow of DART ended up evolving in a way that really has been effective, both in our pilot and now that we have begun to roll it out house-wide as early as September 1st of this year. Anyone can activate a DART. The first step would just be to notify the unit clerk or the bedside nurse. The next step would be these individuals would contact the other team members of DART, including social work, security, the bedside nurse and/or charge nurse, and if available, a member of the MD team. The social worker and the team debrief outside of the patient's room, and then enter the room and help have a discussion with the patient or family member that's causing some of the stress, set some guardrails and expectations, document this agreement, and place it in the chart. Additionally, with the help of our EPIC team, we will put a flag in the chart so that other individuals know that the conversation occurred and what the agreement is. DART and SAFE were developed to help provide this type of support.
For questions about SAFTeam or to request a consult, please contact me at collier@stanford.edu or at 497-9902.